Hi everyone, and welcome to today's Festival of Debate event. Thank you very much for giving up your time to join us this evening. We do still have one or two people joining in from the waiting room, so I'll keep an eye on that, but we will make a start, as I know some of you have been waiting in the waiting room for a while, having been very punctual and early. Tonight's event is obviously part of the Festival of Debate. My name is Johnny. I'm going to be hosting this evening, and the Festival of Debate is part of, I work for Opus Independence, which is the social enterprise behind the Festival of Debate. Since 2008, we have run projects including Now Then magazine, Word Life, and the festival to connect music, arts, culture, and ideas to help make change. The 2022 festival started on the 19th of April this year and runs through to the 30th of May. So there are still one or two events that you can get involved with as well as tonight's. Our aim is to get people talking about the key social, economic, and political issues of the day. We run the festival in partnership with over 70 partners, including local campaign groups, universities, and arts organisations to help inspire the city to engage in debate and active citizenship. Before we begin, there's obviously just a couple of housekeeping issues I just want to highlight. One of which is, despite the desire to do this event in person, we are online this evening. So if you do hear any sort of fire alarm, it is something that you should probably check in the kitchen as soon as possible. The toilets are situated wherever they normally are in your house. So we're not going to have any official breaks over the next hour and a half. So please feel free to use them as and when you like. We're going to have a series of short perspectives of around 5 minutes each from each of our wonderful panelists this evening. And then I've prepared one or two questions to get the conversation going. And we will be coming to all of you at regular points to get your inputs and ask your questions. We have the ability to for you to ask those questions live. So if you would like to do so, if you could just, when you put your question in the chat, let us know whether you're happy to ask it yourself or whether you would like me to ask it on your behalf. We are recording this evening, so just to make everybody aware of that. So if you have your camera or microphone on, that will be recorded. And if for any reason you would not like to appear in the documentation of the event, but would still like to ask a question, just direct message me using the chat function, and we'll either pause the recording or find a way to make sure that your question can be asked and we can get the information you are looking for. One last final thing before we get going, and I hand over to our first speaker. At the Festival of Debate, we are committed to providing an environment that is welcoming, accessible, and inclusive for all attendees and all of the team members and volunteers in person and online. We therefore ask all audience members to be civil and respectful at all times, give others the chance to speak, and remember that others may have lived experiences different to their own. Harassment or harmful behaviour has no place at our events or on any of our online platforms. We won't tolerate language or behaviour that is racist, sexist, homophobic, transphobic, or ableist, or oppressive to fellow audience members in other ways. I'll be monitoring the chat throughout, and if we have to deal with any of that, we will do so. But I'm sure we're all going to have a lovely conversation. So you've listened to me speak for far too long. So I'm going to hand over to our first perspective of the evening, which is Paulina, who's going to talk to us about the contact tracing that all of the event is kind of centered around. Paulina, over to you.
Thank you very much, Johnny. And I'd just like to welcome everybody to this event, which was organised and called upon by the Sheffield Community Contact Tracers. And I really would like to speak about the work done by the Sheffield Community Contact Tracers, because it's really been quite an impressive job and an impressive body of work. So if anybody doesn't know yet, the Sheffield Community Contact Tracers was formed around March 2020 by a group of retired public health officials and GPs and community people working with communities like Darnall Wellbeing, under the auspices of Heeley Trust. And it was first established in March 2020 with the initial intention to train people to do contact tracing for the residents of Sheffield. And this was before the government started its national scheme of contact tracing. After setting the scheme up, I don't think a lot of contact tracing did take place, although it did take place, I think, in a hospital. But I'd really like to focus on one specific initiative that took place, which was the work that was done around COVID confidence, which was basically the meeting, the ability of communities to get together to at a time when information was changing, it was uncertain, it was unclear, it was very new, it had to get to communities, and it was very difficult to make sense of a lot of that information. So the initiative, and it was the initiative, I think it was the idea of Janet Harris working with Darnall Wellbeing to bring together different people from different communities and volunteers to try and discuss and make sense of a lot of this information was really quite essential for tackling misinformation, tackling confusion, and to build trust that was needed in order to get people to behave differently, in order to get people to behave accordingly, and in order to also in order to prepare the work for what then became the work around vaccines. So this work involved, it was carried out in 3 neighbourhoods. It was carried out in Darnall, and it was carried out in Sharrow. It was also carried out in Burngreve. And then I later learned that different communities following the initiatives of Sharrow and Darnall, COVID confidence meetings were held by different communities. And one of the things that really was important for me to understand was that was really important initiative was the ability, the bringing to speak in front of communities of local scientists, of people that understood the science. So like general GPs came to speak, people that had expertise in public health. And one of the things that was very important about this was that by organizing these meetings, it really allowed community members of the community, voluntary organizations, to not only listen to the science, not only listen to the scientific thinking, but actually also question that science and make sense and question and debate in a sort of open way. And this was pretty essential at that time for really building the trust that was required. Thinking about it later, I think, and this is, I suppose, my main lesson from this, it became, in my mind, a really good model of how in the future we need to bring some very complex scientific ideas, complex scientific debate into communities. And it's the need for academics, for scientists, for researchers to really embed themselves or create links and embed themselves with community organizations. We really need, as an academic myself, I'm an academic, I work on innovation in Birmingham, in the University of Birmingham, although I live in Sheffield. What I really learned from this was the importance of having academics and scientists embedding themselves in community, understanding the problems and the challenges communities faced, and therefore, and also be able to bring our scientific knowledge to communities, discuss, be able to be questioned in that way. For me, that was one of the most important lessons that I've learned from Sheffield Community Contact Tracers, above all from COVID confidence. I think there's an incredible amount of, we're in the process of writing an evaluation report, which I hope everybody will read when it is written, but a huge amount of knowledge and expertise about how communities collectively learn in a period when knowledge is changing, when knowledge is uncertain, when knowledge is incomplete, when knowledge is moving forward. How do we then collectively make sense of that knowledge in order, and make sense of those advice in order to go forward? So I leave my comments here, Johnny, but thank you very much to start the discussion.
Brilliant. Thank you, Paulina. That's wonderful. We are going to go to Shona next to get her oversights and insights into public health. Shona teaches at Sheffield Hallam University and has taught and done research into public health in 3 English-speaking countries. She's lived in the UK for nearly 20 years now and rails against the dismantling of the public health system since 2012. So Shona, over to you.
Hello, and you can tell I'm never going to lose my accent. 20 years, and but everyone at home says I have an English accent, but I don't. I just use English words. But the when I came here, I think I came thinking that public health might be better regarded than it was in Canada, because it was the poor relation in healthcare provision. It was always everybody's last choice, in spite of us having had a rather public epidemic in SARS. And I remember being quite surprised at how fragmented public health was. And that is always a problem. Public health is always fragmented because it looks at the big perspective. The entire population tends to work with numbers, but also has health promotion thrown into it, also has healthcare planning thrown into it. So everything that the rest of medicine doesn't want to have to do tended to get thrown into public health. And then I had gone to Australia for a couple of years in the middle for a research appointment. And I came back here just in time to have them essentially dismantle what was left of the public health system and remove our expertise in infectious disease outbreaks. So, contact tracing and all of that kind of thing. Also, aren't we lucky that Jonathan Van Tam was still here and hadn't been poached away and was able to go into government and try and advise the government. So I can remember thinking, I think we're going to have a problem when I thought I came down with COVID actually the week before lockdown, and I had been watching. As an epidemiologist, you tend to be on those mailing lists, and I was looking at the numbers thinking, oh, blast, here we go. This is going to be a big problem. And where's our expertise? Our expertise has been fragmented, poached away, retired. And what are we going to do? Well, hopefully somebody in the government would be listening. I think we can all be slightly cynical about that. So I was unsurprised. I had to spend a lot of time talking to my colleagues at work and my children and their friends about what I would thought of as absolutely basic principles. Everybody gets exposed to things every year, but most people don't become ill. All kinds of things like that, absolutely basic things. People had a real lack of what my dad and my grandfather would have called common sense understanding of everyday health. And so it was quite interesting to have someone say to me, oh, I've just run a marathon. I won't come down with COVID. Right. I work in a department with a lot of athletically inclined people. So it was, but I have to be honest, I haven't been surprised at anything that's happened. I've been disappointed, but I haven't been surprised. If you don't have emergency preparedness that involves an epidemic and a natural disaster and a nuclear meltdown, then you don't have disaster preparedness in any country in the world. So I was not surprised. Neither was I surprised at how distrustful people could be about the information. And I thought we tried very hard, honestly, at the national government level. Sometimes I often felt it was reluctant, but I think they did try to explain things, but people weren't paying attention to those messages. They were just looking at the Facebook posts from people who were, I don't know how to describe those kind of people. Just to have too big of an audience, sorry. But I don't want to blame Facebook, because we all take the responsibility for having some basic understanding of how the world operates. So I'm happy I'm hoping we got some good debate. I recognize a few names in the audience, so I think this could be really interesting. Although unfortunately, and I don't mean that in a negative way, folks, but they're my colleagues from up the road. So we'll try to not let this get too academic.
Brilliant. Thank you so much, Shona. I have put a message in the chat encouraging everyone to drop their questions into the chat as we go. Don't feel like you have to wait till the end. Get your questions down, and it might help inspire others to think of the questions they want to ask as well. You should have a button at the bottom that just says chat and looks a bit like a speech bubble. If not, it will be under the three dots with more written under them, and if you hit that, it should bring up a number of options for you to be able to find that chat function. We have obviously a couple more perspectives to go from our panelists, and we are going to go to Yvonne next. Yvonne lives in the Darnall ward and works at Darnall Wellbeing as a senior health and wellbeing worker. She's worked at DWB since 2011, supporting residents to engage in physical activities and managing their health conditions. For anyone that doesn't know, Darnall Wellbeing is a local not-for-profit community health organisation working to help people of Darnall, Tinsley and the neighbouring areas stay healthy. So Yvonne, over to you.
Hi everybody, good evening. I think this event has instilled in me that there are so many different information that's still circulating about COVID that still is not comprehended by many people within different communities. And I think from my point of view, and a representative of Darnall Wellbeing, we have done as much as we can do to raise the awareness about the importance of the information that we share with residents, service users, participants who attend activities. We are a community hub in the area, and we do so knowing that there are people in the community that would need extra support during the COVID pandemic. And we continue to support people, but not on a larger scale as we did during the pandemic. And I think there are so many different concerns where people may come to us to ask questions. We're not medically trained. So we work as, health and wellbeing workers to support people, to manage health condition. They may come to us with other personal issues that we support them with and signpost them to the relevant organization. But our aim is to make sure that whatever information that is filtered down to us from public health, from CCG, Sheffield City Council, that we are helping them to understand what is going on, and they can rely on us to give them that information. But it's what do they do with that information at the end of the day. Our remit, is a wide remit, and there have been some instances where people need that extra support due to language barrier, and we try our best to do that. One of the asset and the very positive thing about Darnall Wellbeing is that we have staff who are bilingual and they speak different languages, and that comes in really handy when working with people in the community, to be able to translate and to talk to them on a one-to-one for them to understand what is going on. As Paulina mentioned before, we were very instrumental in the setting up some of the COVID workshops for people to come and understand, to ask the relevant questions about what is going on, how it's impacting on them, and the importance about vaccination. Why should you have the vaccination? And if you choose not to, so people were at the events to answer those questions, and it varies at different times who attended those COVID workshops to be able to receive that information and join in the debate about what is happening in the community, for community to be informed. So I'm really pleased that I'm here, and a lot of experience have been shared with me, and some of them I will talk about tonight. Thank you.
Brilliant. Thank you, Yvonne. Really appreciate that. Our next speaker, before we get into asking some questions, is Susie. Susie is a health and wellbeing development worker for Marn Somali Mental Health Sheffield. She has worked for the organisation for the past 14 years and has over 40 years experience being involved in community development-based work, 25 of those involving community development approaches for health. Marn SMHS is a community-based charity with over 27 years experience. It supports Somali people, their families and carers impacted by mental health issues. They support mental health literacy and development across the Somali community in Sheffield. Their approach focuses on using preventative approaches, including community development. Susie, over to you.
Right. Thank you. I'm happy to see everybody here. It sounds like we're going to have a lively debate. So I think I'm really pleased with what I've heard from Paulina, Shona and Yvonne so far. They all resonate in the things that we experienced at Marn. Marn had a really interesting entry into 2020 March in terms of finding out that our most vulnerable people were faced with a situation where they didn't have a means of actually accessing support and help and making sense of where they were in terms of their mental well-being. And in addition to that, those people had to manage the local and national situation of accessing health, about health and well-being. The point that Yvonne made is really important about people's linguistic wealth wasn't treated as a wealth at the first parts of the pandemic. It was seen as a linguistic sort of like something lacking. Information for people, for instance, that we supported that needed to go to hospital and how to take a COVID test were posted out. And what language were they written in? English. Even if you were an English person, you may not read and write. And even, you know, with the best will in the world, the diagrams that were given were not always helpful. So those are some of the things that we learnt about. Our experience at Marne Somali Mental Health Sheffield is that when we find out about the sort of like contact tracers, and especially the COVID conversation, it was like somebody turned a light bulb on. We as a team had tried to educate ourselves partly with the sort of national picture, partly with the local picture in public health, but it all felt complicated. And the bit that gave us a light bulb moment was when we attended, I think our first COVID conversation event, sort of like put together, was at Darnall Wellbeing. And I live in Burngreave, our team lives at different parts of Sheffield, but we work across the whole of Sheffield. And it felt as though you had a space where people were bringing together medical information, they were bringing together local concerns and issues. And it wasn't about people being told, it was about sharing, unpacking, and people working together to kind of construct what's a good way of getting this out, would this work? So people asking you, you know, what's happening. And I thought, gosh, why don't they do that, you know, all the time? So being asked, in a sense, what information works. And through the contact tracers, we were able to work with local Somali community members and run our own community conversations in Somali. And one of the successes, because of the experience we had with all the different contact tracers and the community conversation events we went to, we felt we were able to understand the bare bones of it. And we had support from people, from the contact tracers, to come and give us an additional help. One of the biggest sort of like turnarounds for Marne was that when we were able to get a GP from Nottingham to break down epidemiology, but in a simple way, what was happening to your body, what things were happening. So people had an event that was solely in Somali, and the only people that needed an interpreter were the English-speaking people. And that information empowered people to ask difficult questions, challenging questions. You know, it wasn't, not everybody was, you know, coming from the same perspective in terms of what COVID was, but that was actually really important. And I think that was a legacy of what we took forward in anything else that we did in that sort of way. So I'm happy to kind of like, you know, listen and learn from all of the participants tonight. And I'm sure those of us on the panel will learn as much as we're hoping to share in terms of what our experiences have been.
Fantastic, Susie. Thank you for that. So we have a few questions that we got to get the conversation going, but as Tom has kindly done so, started putting some questions in the chat, which we'll come to in a second. So please feel free to join him and start to put your questions into the chat that you would like to ask to our panelists. I'm going to start us off with, I suppose, a two-part question, really, that speaks to the subject of our conversation this evening. So for all panelists, whoever would like to take it in whichever turn you would like, how do you think communities can deal with misinformation? And to go with that as well, why is trust so important, and how can it be built in those communities? Shona, you like to go first on that?
Yeah, trust is probably the single most important factor in public health. If we don't trust public health to look after our health, to give us safe vaccinations, to make sure that the water is safe and all the other basic things, then we don't have anything. To be perfectly blunt, public health can't operate unless it operates with the will of the people. I remember having a conversation early on where we were saying things like, do we have to go to, mandatory, what they did in the typhoid era, back when Typhoid Mary was running around spreading the disease and refusing to admit that she did. And I thought, no, because society doesn't run that way anymore. The government doesn't dictate, and we have to say, yes, sir, because it was mostly sir in those days. Yes, ma'am, how high do you want me to jump? People have to buy in, and that social component of other people behaving like everyone in their social group. Go ahead and have a look at my YouTube video, but people behave like everyone else around them. That social component is so important, so important. You are most likely to trust the people you are closest to, rather than some distant boffin with bad hair standing at a platform on television every blessed night. Okay, so what else? I do like living here, honest.
Thanks, Shona. What other thoughts do we have on this from our panel? Paulina?
Yeah, I mean, I think I don't want to talk about disinformation. So if we think about disinformation as false information that is spread deliberately, I'm not going to deal with that, but I would like to deal about the problem of misinformation, which is when incorrect or misleading information is spreading, but it's not a deliberate attempt to do this. Because I think in the situation that we were dealing with, misinformation was inherent in the situation. And so what we have to think about is how do we deal with situations of misinformation? And the reason why I think misinformation was inherent is because we were dealing with a new virus, the science around the virus, some of it was well known, but some of it was new. So we were dealing with scientific information that was new, that was changing because we were learning about the virus and learning about what worked and didn't work as things were going along. So it was new, it was changing rapidly. A lot of our information was incomplete. So we knew bits of information that worked in some contexts and not others. I think there's also this issue that a lot of the information was contested. So there were differences of opinion among scientists and different interpretations, even amongst experts and scientists, about what certain, what the implication of some of the elements of the virus and how do you deal. I mean, even things like, for example, if people that had natural immunity or had the virus should be vaccinated again or should be vaccinated or not. And this was something that, for example, arose in the NHS when the government decided that NHS workers would have to be vaccinated. And there's also this issue of probability. So there was a lot of information like, this treatment is likely to be good, but we weren't 100% sure. And I think all these lack of clarity and all this uncertainty is inherent in a situation where you're facing something new. Okay, so it was complex, it was difficult. So the key question is, how do we deal with that? Because that was really the challenge we were facing as far as I'm concerned. And I suppose this is where I come to the issue of the community scientist, because in order to be able to, issues of trust. So when you've got a society where there is low trust, okay, and these tend to be societies where there's huge wealth inequality and income inequality, and when there's huge, when there's histories of oppression and repression, bad working conditions, those are the conditions that breed distrust, which is the conditions we've lived in. Then when you're facing the situation of distrust, how do you then try and make sense of this very complex information that was going around? And I think that was a challenge. And for me, I think this is where I think the Sheffield Community Tracers, for me, and the COVID conversations, and actually the specific, I think there were training events that were done to community leaders where scientists came, were so important, because what it meant to me was, in some ways, you need to have scientists in communities that communities trust. Okay, and this was so important. So one of the works that the COVID Confidence did and the community contact is they brought GPs. GPs that have always lived in the communities. People trusted those GPs. You know that GP had your back. You knew that GP cared about you. And those were the people that the community trusted. So that was the scientific information that the community trusted. So in some ways, what I'm saying is that in this sort of, in order to overcome these issues of misinformation and distrust, what you really need to do is create this link between scientists and communities. The communities need to trust the scientists. They need to trust that the scientific decisions and advice is not because the scientists want to further their career or their knowledge, is because actually they have the back of the community. They're interested in that community, and therefore the community can trust. So how do we build that network, those networks? And this is not something that can just be brought about quickly, in the middle of a crisis. This requires a very long-term strategy. It takes years to build that trust. And I think that's, for us, the challenge. How are we going to create that type of link between scientists and community over a long period of trust, so that the community can really trust that their scientists are giving advice, the best advice for their communities?
Thanks, Paulina. We're just going to come to Jack as a now retired GP to feed in a comment on trust, and then we'll come to Yvonne and Susie for their perspectives on the questions. Jack.
Oh, hi. Yes, thank you, Johnny, and hi everybody. Yes, I'm a retired GP. And I worked in Darnall, so I know Darnall Wellbeing very well. And I think I just wanted to pick up Shona's point about the issue of trust. And so it isn't just public health. It's also, the general practice primary care, and the understanding that I've always had as a GP in a community, that you get to know your patients, you get to know their families, and you get to know the community, who is in that community, what the social mix is and the ethnic mix, and that you understand what that community is about. So there's a sort of as well as looking after people who are presenting with symptoms and helping them, but you have an understanding of the environment you're in, and you can start to do what people would call public health, but on a sort of primary care level, not academic public health, or even it's sort of quite local. And this is about the things that we're losing in primary care, like continuity of care, for example. Big issue. And lots of real difficulties within primary care at the moment, because there hasn't been planning, workforce planning. We haven't got enough GPs, we haven't got enough primary care staff, we haven't got enough people working in the health service generally. I don't want to go there particularly, but unless people who are seen as trusted people within those communities are able to do their work, they're not burnt out, they're not about to retire because they can't go on. We need those people, and I think so I was involved with the contact tracing group that's been talked about, and because I had those links, I think I was able to contribute and try to be some sort of, as Paulina says, a sort of community scientist. And I think that people who know me, I hope, trust me, and therefore the things I say are generally listened to. But I think people like me and others, at the beginning, we didn't know, as Paulina has said, we didn't know much about this virus. We thought perhaps it was more like influenza, and so we had to change what we said. And I think part of trust is being able to say, look, that's what I thought then, but now I think things have changed, and I'm able to say, that I was wrong then, but I think it's this now, and those are the reasons.
Yep, absolutely.
Okay. Brilliant, thanks, Jack. I thought that was a really useful insight. Yvonne, Susie, it would be great to hear from you both on our start questions.
Yeah, do you want to go first, Yvonne? Go ahead.
Yeah, I'll go first. I think I've made some notes, and some of what I've wanted to say, Jack has covered it. I think trust starts from that initial contact with an individual that you have that one-to-one relationship with, whether it's your key worker, your social worker, or your GP that you've built that relationship with in the community, at your surgery, or in a wider network of friends or a social group that you have. In terms of the COVID, what we did when we decided to pause all physical activity, or face-to-face activity, I should say, that we built up a program of one-to-one keep in touch, whereby we phone people on a regular basis, especially the vulnerable people. And if they ask questions, we gave them as much as we knew and understood. And I think some of the information is about what do you interpret from this information that's been cascaded to you, and how well you share that information with the person who you feel and expect to trust you to tell them the right. Not everybody is perfect in getting things right, but I feel that within the community, people will go to those that they have that relationship with and build that trust with them, and it's an expectation that the information that is being shared with them is the information that they feel they are trusted that individual to share with anybody else and feel safe with that. I think the other thing I wanted to say is that, when we say about misinformation, information will spread. One person will get information, but how is that information curtailed? How is it that we ensure, have we got the powers to do that anyway, that this information is not kept spreading and spreading and spreading, so people then get confused about what is the right information in terms of protecting themselves, protecting their families, and keeping safe.
Thanks, Yvonne. Susie?
Yeah, I think the issue of trust is also about trusting that people in communities are sort of like, part of the process. So, Pauline has talked about, the, community-based scientists. It's making sure that, I think, in a trust relationship, that there's a compact between, people in the science health field and communities, and that communities themselves are sort of like part of the process of the learning. And I hadn't seen anything from the government that, brought to the table what the contact tracers and the community conversations did. And that's a space and place where there was a trust being built, because people were able to interrogate. And Jack made a good point. Yes, things change. So something we may have said in, July of 2020, right, okay, we need to update that. And that's what we knew at the time. But people were in conversation about that. So there was trust that this person isn't trying to be, know it all and whatever, that they are exposing what they don't know and what they're learning as well. So I think MARN and other voluntary community-based organisations learning with the community, being honest that, we relied on others to be able to make sense of things, to critically review things. And the point that Yvonne's just made is really important. And one of the first things that we found when we were working with some of the WhatsApp groups is what's trying to sort of like build people's sense of, well, what are the critical questions you need to ask when this information is being shared? About whether white flour is going to kind of like, make you immune from getting COVID. So it's not saying to people, oh, no, you're wrong. It's about engaging people into the actual process of the critical thinking. And not easy, and it's hard, but important and valuable in terms of whatever we do when we're trying to say that, we're all part of the picture, that it's not just being recipients of information, but people themselves can be part of the discourse and can actually be critical in thinking about what's happening and what are their thoughts and preferences.
Thanks, Susie. I think, yeah, it's a really important kind of piece of learning that I think we've all come to the conclusion of is that willingness to engage in critical thinking and assessing information is so key, especially when we're often overwhelmed just with the amount of information, even before we get to assessing whether it is disinformation, misinformation, or actual information. I'm going to come to our first audience question. I don't think this has been directed at anyone specifically on the panel, so anyone that would like to respond. It's from Tom, and his question is, did attitudes to the government affect the discussion on health information, and did it help that the Prime Minister was doing his daily briefings? Shona, as a massive fan of Boris Johnson, would you like to comment on this?
It's funny, I can remember sitting, if it's one of those jobs that it's both the Prime Minister's job and the people advising him jobs, it's really tricky, right? And sometimes you have to deal with the ego of the body that's doing the, who's decided that they're going to do the announcements. And I suspect there was, nobody's told me this, but I suspect there was quite a bit of negotiation going on in the background. And certainly in the early days, I'd be sitting there thinking, no, that's the wrong way to describe that. That's just wrong. You're not listening. And then he would backtrack. And if you noticed, he did slowly get replaced by Chris and Jonathan. A JVT. So that I think the message, he managed to mess it up enough times that somebody reined him in. But I've forgotten her name. I apologize. The Prime Minister of New Zealand. She was the voice in Canada. It's where I come from, British Columbia. The female premier, maybe it's a woman's thing. The female premier of the province of British Columbia became one of these highly regarded people. Didn't stop the media from occasionally trashing them. So it's a difficult role, but that Boris probably believes that people trust him. So he wouldn't have seen why someone else would take the attention. But sometimes we need to be honest with ourselves about whether we're a good communicator and people trust us. I suspect he wouldn't make the same decision now as he made back 2 years ago, 3 years ago. I'm losing the plot now.
Thanks, Shona. Anyone else thoughts on the attitudes to the government affecting the discussion of health information, and whether the Prime Minister's briefings helped or whether they were breaking through and reaching people?
Shall I? I mean, so I'd like to hear Susie and Yvonne's experience with this, but that would be really interesting. But it's not just Boris, the whole government. I mean, I think in my conversations with people, one of the things that was very clear was the stench of corruption of the whole thing about, all around the testing and the PPE and suddenly the government giving these sort of quick track deals with Parliament, with members of Parliament that had their businesses. It was all so shoddy businesses that were happening, as well as questionable, questionable activities. Of course, since then, we've, as we know from Partygate, now it's even worse. But I think there is a fundamental distrust in society, and I think correctly so, because government did not. I mean, even from the beginning, a lot of the their response around COVID was also very self-centered, or how can we get money out of it? How can businesses move forward? And that, even for example, around the lockdown, there was a lot of discussions. Is this motivated by health, or is this motivated by keeping the economy and keeping profits open? So I think the lack of distrust and the lack of trust on government was an important factor. But I'd like to hear Yvonne and Susie's experience on this, because mine is probably much less relevant than yours.
I totally agree with everything that Paulina said. In my own view, and I'm speaking from my personal perspective now instead of Donald, on behalf of Donald well-being. Can we trust somebody who can't trust themselves? The pandemic wasn't the Prime Minister. And he played his part in what he felt he had to do. Did the update, did the briefing help? It may have helped some people, but it was sometimes conflicting information. the media send one thing, he send another thing. How do you tune in to that information when you're getting something else from the news or something from your local authority? It didn't help me in the sense that I just stopped listening to it. You have to make your own decision about what you're going to trust, who you're going to trust, and what information you felt was relevant to you to keep yourself safe. And I think that, yes, we can encourage people to listen to the Prime Minister, and we can encourage people to listen to Greg Fell and to watch the videos and to share the information with them. But at the end of the day, what information is there that's going to help you, that when you turn around to someone, they may say to you, I told you not to trust this person, or I told you not to trust the Prime Minister. It's for those people to listen and understand what is cascaded down to them. And at the end of the day, Boris is a human being who will give his own opinion, and there are scientists there that's briefing him, but do we get the full picture of everything that's going on? You know, one of the things was, right, should I get vaccinated because I'm pregnant? Should I get vaccinated because I've got sickle cell? The Prime Minister said do this. The Prime Minister said don't do this. Who do you trust? Do you trust him? You know? So those are some of the arguments that's been going on during that time. So I stopped listening to it, but I wouldn't encourage people to stop listening to it. That's just my personal opinion.
Yeah, it is complex. I mean, one of the things that we found at Marn is that back in 2020, there were more Somali people, especially the elders, that were watching news from in Somaliland than the UK generated information. So there was a really strange time that we were sort of watching as a team. We were watching Boris, and I think you've summed up a lot there, Yvonne. I was thinking it's like you really couldn't get hold of, in a sense, where they were coming from or what was their priority in terms of, you know, the health of the nation, which is an interesting thing that we don't seem to talk about anymore. So we found that having access to Somali GPs, Somali chemists, Somali scientists, epidemiologists was one particular one that was really a turnaround for people getting access to sort of like, you know, really important information. So trust in the government, I don't think it was brilliant, but I definitely saw parts when people were at least logging into it, and there felt a time as I think sort of like in 2020 where people weren't listening to the national news as much as they were sort of like looking for other sources. And unfortunately, there were cleavages, were opportunities for both mis and disinformation when sort of like what felt like what was coming from the central government didn't always feel credible and always feel as though it worked with who you were as a community.
Thank you all. They're really good intakes, and yeah, it just occurred to me that when you were talking there, Susie, about where people actually get their information from, it's probably something that we've all attempted largely to blot out of our minds. But a lot of the information, or at least kind of coverage that we saw, was actually coming from the US, because it was that guy that we don't speak about anymore talking all of the time, and the media were covering it regardless of whether it was blatantly rubbish or not. In talking in terms of kind of information and in information sources, we've had a question in the chat from Andy, which is, how important are public libraries, given that librarians are largely trusted, but public libraries are largely under-resourced or used? What are our thoughts on that? Does the public library hold that kind of trust relationship in a strong enough way that allows it to share and pass on information?
Public libraries are essential, and public libraries have been decimated. When I used to do a lot of community development work and courses around the country, we used to talk about a basic toolkit in terms of, you know, resources for people to get together in groups and communities to create change that brought about, you know, the better lives that they want. And libraries was always a central component And when libraries were being attacked and under-resourced, we always promoted people making sure they made use of whatever libraries were there and challenged any sort of like, you know, moves to close libraries. You know, they are a very important space. Post offices and libraries, two things basically, that if you are not the poorest of the poor, you may not get it. But if you are, you will realize it. Most of the communities, I mean, Yvonne, you probably experience the same thing. One of the diverse communities that are in Sheffield or other parts of the UK, when you're trying to get information in your first language, in terms of a newspaper, in terms of an audio book, where do people go? Libraries. When people are new to Sheffield, when you haven't understood the systems of what's going on in Sheffield, libraries are often a place that people go to try to gather some basic information, get some support. People can go to libraries when you're cold, you know, and you don't have enough money to heat your home. And then on top of that, then look at all the things we've just been discussing in terms of, you know, access to information, access to spaces and places where, you know, you've had some incredible workers in the library system that's actually moved towards community development approaches in some ways when the resources have been there, helping people to come together to make sense of how to use those spaces. So yes, I'm sorry, I couldn't remember who asked that question, but very good question and very, very important point.
I think for me, I do echo what Susie says. Library is very imperative in any community whatsoever. And it's just a shame that, you know, resources are not as much as they used to be. When I returned to this country, you go to I went to the library for everything. You didn't have internet then, didn't have a mobile phone, and encouraging people like the Six Book Read, encourage people to go to the library, get Six Book, and to develop their English speaking, develop English by reading and kind of, you know, summarizing what they've read, and go and get to the town hall and get a certificate to congratulate them that they've improved their English. In terms of information, you know, the library was one of the places that was mostly hit during COVID. They had to close for the safety of the public and the safety of the staff. So they had to close. So a lot of people had to rely on information from other sources. And that's when sometimes it's misinformation. And the library produced information that people readily pick up about activities in the area, about, you know, different things that's happening, events in the area, and it helps to build their confidence, you know, by even going and using a computer. Not everybody has got access to internet at home, so that library is not just a building with books. It is one of the biggest sources of information for a lot of communities.
Thank you both. Shona, you have your hand up.
Yeah, I mean, it's all part of the inequalities discussion. I've been working on this for 30 years now, since '85, believe it or not. It's not a new idea. It's not a new problem. If anything, it's gotten worse. And if you look at the distribution of advantage and disadvantage, libraries are one of the few advantages that were accessible to everyone, regardless, as long as you could read. And even if you couldn't, sometimes the librarians were extremely helpful, and they would help you with forms and things in the old days. I don't know whether they have the capacity to do things these days. And this is all part of that whole debate about the inequality in society, the unequal access to resources. And resources can be basic things like the library. They're not just housing and food and all of it, it's everything. I always describe going down the bottom of the social scale like as accumulated disadvantage. Factor after factor after factor just pile up. And if you're in the middle, you don't get it. If you're at the top, you absolutely don't see it.
Thanks, Shona. My screen flipped to you, Paulina. You wanting to?
Just very quickly. I mean, I think that the issue of the library is a very important one. I think it's something that we're also going to have to rethink about the role of libraries as we go to a more digital, society, and including, for example, digital health. And the role of libraries in helping people manage information, even if it is in a digital way, the role of libraries in supporting that process of people dealing with digital information is really quite key, quite crucial. I don't know if there has been a lot of debate about that, but I think that the importance of the library, of a place where people come together to discuss things, to search for information, to expose themselves sometimes to new information is really quite crucial. So it is part of the whole building of community strategy. For me, the library is central to, as everybody said, is central to that process.
Thanks, Paulina. The next question that has come through on the chat, I'm going to tweak slightly from what we've been talking about, because I think there's a really important factor here that you've all been discussing is how, as knowledge and understanding changed over time, that willingness to evolve things and change being an actual route to generating trust, as well as actually sort of having the right information. But the question is from Carol. And they say, what do you feel was your biggest mistakes? And I'm going to tweak that to say kind of like, how did you learn from what turned out to may have been mistakes along the way and adapt? And did that help with actually kind of this element of trust that we've been talking about and the importance of finding ways to build it? Susie?
Right. It relates to something we spoke about a little while ago. I think early on as a team, we did use a lot of information from central government. And I'm not saying it was wrong to look at that information, but I think, you know, as time went on, when we were trying to engage with conversations with, you know, members of the community, you know, just saying, oh, this is what Boris said, or, you know, this is what we've seen as the latest national news, that wasn't enough. And I'd say, rather than looking at it as being mistakes, it's the word fail, first attempts in learning. Our first attempt in learning about COVID was that we went to that national resource. And as we went forward, we came across the contact tracers, the community conversations, and we learned and we became more astute ourselves in looking at the balance between what was happening nationally and what was happening locally. And again, we realized that there was something happening from a community-based voluntary process that gave us something that helped learning that was missing from what we tried to do when we just looked at the national reports of information, basically. Because the national information, in the way that Shona spoke of earlier, I don't think they were prepared to engage with communities at community level. They were wanting to give out almost large globules of information that you had to access if you were English speaking, literate, able to kind of like follow information, as well as dealing with all the emotional stress and pressure of the lockdown conditions. So that's one of our first attempts in learning.
Thanks, Susie. Shona, would you like to come in on that? Did the health service make any mistakes or first attempts that they then adapted to improve?
Yes, they do. And this is I think what is the biggest learning point for everybody, is that knowledge isn't fixed, it evolves. We have to go on best guesses, and hopefully they're experienced guesses, not somebody who's a media profile person, you know, who's in the media but really doesn't have extensive knowledge. Doesn't mean anyone can't learn, but some people are listened to simply because they're prominent footballers rather than because they have any expertise. And it is, knowledge isn't fixed. It has to constantly change. And I think that's been the most difficult thing for most people to understand is, and the world is constantly changing. Our knowledge is constantly changing. The diseases we're going to get and be exposed to in the future, or, you know, this kind of thing. And we've been living in this oblivion to the fact that the world isn't safe and predictable. And it's been really, 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 really difficult. Paulina might have disagreed with me on this one. See, academic debate. Actually, it's just friends debate.
Thanks, Shona. I suppose I've got a bit of a follow-up question to that, which is obviously you mentioned Jacinda Ardern, who was held in very high regard for her willingness to engage in that conversation from the kind of the position she held with the whole of the public, and that put her in very high regard. Rather than as necessarily identifying mistakes, were there other countries that kind of worked it out sooner or got it better, do you think?
Nobody got it right completely. And it was just there's just been a report on this. So initial approaches might have worked better in some countries than others, but didn't work in the long term as the disease evolved. You know, there's no single right answer. And you literally don't know what you're going to be dealing with, and you have to just go through. I think the other big piece of information that everybody needs to understand is that 2 or 3 case reports, particularly that come with horrible photographs and really upset people and things, isn't typical of everyone. Sometimes the media has a requirement, or certainly the BBC does, to report both sides equally. But what if one side is represented by 2 people and the entire rest of the country is represented by the other side? Why would you have a balanced report in that context? Also, who's the judge, right? Hey, doesn't it sound like I'm in public health? But you know, this is tough. This is really tough. And there are no black and white answers, and nobody has zero risk.
Thanks, Shona. Yeah, and I think that's a really important point around and how these things are portrayed. Obviously, it's a different set of information or misinformation, but the climate crisis has proved time and time again in the way that that's kind of reported fairly, where 97% plus percentage of scientists say that it is, and they still have the representation on a one-to-one basis of someone that's saying it isn't, and that in the way that communicates without really being said, that there is some sort of balance there when there clearly is not. Paulina, you wanted to come in on this?
Yeah, I would like to raise perhaps for discussion a case that has been considered quite a lot as a success, and we have discussed it as well in the Sheffield Contact Tracers, which was the case of Taiwan, and what, you know, whether that was a model to follow, and in lots of amongst many people we have discussed whether Taiwan was a case, and but the point I want to bring with that is the importance of context and culture, and knowing deeply what is involved in some of these measures. So one of the things that was interesting at the beginning in Taiwan, and that, you know, because they did have very low levels of deaths at the beginning, and therefore it was lifted as a sort of as an example, but a lot of that was also based on a lot of monitoring by the government and a lot of surveillance by government. So for example, my boss is Taiwanese, so we would discuss this quite a lot. She went back home, so things like if there was any case of you know, if you got a ping because you were close to somebody that had tested positive, then you had to self-isolate, which was great. But if you actually went outside, then your phone would send a message to the local police station saying this person has gone home. And if you decided to leave your mobile phone at home and go out for any reason, then the police would come around saying, we haven't seen any activity in your mobile phone. So there was a lot of police surveillance and monitoring around some of these behavioral changes, and I think as a society we that's not the way we want to go. So although in some elements of this, you know, some people thought that was a good thing because it sort of contained the spread of the virus, I think in other ways this was actually quite negative in terms of allowing some sort of acceptance of surveillance, which increased surveillance. Interestingly enough, Taiwan is now gone into a situation above all with Omicron where they feel that they cannot, you know, they've got to live with the virus, that they can no longer contain the virus because the virus has spread even with the measures that they had before. So they have loosened up society. But one of the things that they did say that is interesting is that because of the initial measures that they took, so basically they're opening up society at a time when most people are vaccinated, where Omicron is less, you know, it's less powerful. So they're going to end. So basically, they locked society down at the beginning when the virus was less known. There was no vaccine, and that somehow protected society. And now that they're opening up, obviously the death rates are increasing, but it's not as bad as societies that were open at the beginning. So again, it's complex, isn't it? Because the protection at the beginning was based on this surveillance, which I personally would find very difficult to support, and I don't think would be acceptable in other societies. So understanding the national institutions and national cultures and what's acceptable and not acceptable in the way that different countries reacted is actually quite important in our understanding about the ability to to just transfer practices from one country to another, because they're not transferable, a lot of these. So just.
And would you like reflections from the panel on that?
I would.
Anyone, any thoughts?
I agree with her. I live in one of the 10% most deprived communities in Britain. I live in a former pit town, and to say that defiance to regulations is an embedded part of local behavior would be an understatement. My son was harassed. My son, by the way, is 30 years old, nearly 6 feet tall and not small, was harassed for wearing a mask when he went to the barber's. Yeah. So, and he was working for Track and Trace, sorry, not Track and Trace, the COVID testing, the community testing center at the time, and he was protecting the other people in the building and had been hospitalized for COVID, which he had caught on the job. Right. So welcome to the reality of everyday life. So I think Paulina has pegged it. And also, I think a lot of the phones in this area are pay as you go. It might make it very difficult to follow people. I don't think they have, some of them couldn't download the app in all likelihood.
Thanks, Shona. Anyone else, any thoughts? No? Cool. Okay. I think one of the things that it would be interesting to get thoughts and perspectives on, as well as the actual kind of information that we had around the virus itself. Obviously, there's a lot of kind of legacy implications, if I could say the word, for communities and people coming out of this. Obviously, the kind of coverage of it has been switched off to the point where if you weren't to know otherwise, you think it's just kind of gone because it's not reported so much anymore. But what are some of the factors? Obviously, there's elements of long COVID, and there's a distinct lack of information in and around that, and also the awareness of the mental health conditions that have been exacerbated or literally caused by the pandemic, on both a kind of being a local and a national crisis. So what are people's thoughts on what the other elements in and around this that we're going to have to tackle and are trying to? Susie?
If I can just pick up the point you started talking about in terms of the mental health impact, it's been massive. You had the case where people that have had maybe lived experience of mental health and then been managing in the community to some extent. You had the conditions of lockdown completely, missing people's resources and support systems and structures. There was nothing put in place for the most vulnerable in that sort of way. So yes, it did. We have found in Marne that we've got an increasing number that are being referred to us both by the community, by health practitioners, and some self referrals are coming to us. And during the pandemic, that definitely was heightened. And in addition to that, you had people who had been working with previously that had maybe been managing sort of like their mental well-being, and during COVID it skyrocketed, and there was very little sort of like plans in place to look at those types of vulnerabilities in that sense. Like many communities, we were resourcing and supporting people to access, fundamentals like, going to food banks to get food. We work with a lot of people that are taxi drivers that work in, factories. They work in front-facing jobs, so they were the most vulnerable in that sort of way. So it was quite a challenge. So I know that was only one aspect of what you were talking about there, Johnny, but I just wanted to share our experience.
Oh, that's brilliant. Thank you.
I just wanted to add, Johnny, that addition to what Susie just said, I think it creates even greater anxiety for a lot of people in terms of being having to isolate and not trusting everyone who may want to help them. Some people, it's just, was it a misunderstanding, or did they really understand about what is happening? So they become even more paranoid about what is happening. And I remember somebody who was had mental health issues. They wouldn't open the door, and plus they had diabetes. So they wouldn't open the door for someone to drop off food for them, because they said, you know, you can't talk to anybody, you just can't open the door to anybody. And that was really challenging when you really want to help someone who's got a health condition and had it even double because of the mental health issues, and not wanting to trust anybody who you cannot force yourself to go to that, to see that person. And I think there are other issues where some people said they're not taking the vaccination because they've got mental health. Like the vaccination might mess with what the other medication that they're taking and cause a worse situation for them. So I think it heightened the anxiety, and even some people who have never acknowledged or maybe has been diagnosed with mental health issue or depression, that was the case for a lot of them in dealing with what happened, you know, during the lockdown, not able to see families, not able to see friends. I've never been used to being isolated on their own in a house, not being able to go anywhere or see their families. So I think it affected them more during that time.
Thanks, Yvonne. I think that's a really important point. It's obviously the human body is an amazing thing, but when threat perception is turned on, it looks for all threats and is kind of heightened in a way that it means it's overly sensitized to all sorts of situations. And when that happens en masse, when everyone is kind of super sensitized and kind of to looking for threats and problems, that things can, get quite overwhelming quite quickly. We've got a couple more questions and a little bit more time. Does anyone else want to feed in on that one before we move on?
Just say, I mean, in terms of, I don't have anything to say about individuals in that, but I am about the impact of COVID on society more, and I am very concerned. One of the things that I'm concerned about is the speed at which the NHS is introducing digital technologies, which it started during COVID. So during COVID, the speed at which the NHS introduced digital technologies really increased. So, you know, we couldn't see our GP, so we had to, you know, send cameras and do online appointments and things like that. And this now has become pretty critical to the strategy. I think the NHS was going in that way anyway, but this has suddenly speeded up the process. And that process is happening with very little concern about the implications of this for health inequalities, and very little. It's not that they're not concerned. So in the, you know, when people talk about it, they say, yes, we are very concerned about digitalization and health inequality, but in the decision-making process, when trusts are thinking about introducing digital technologies, they're not really integrating a health inequality element to it. And I think this is something that community organizations need to confront as well, because and COVID has been used and will be used as the reason for this, because you do have an exhausted NHS and things like that. So rather than funding more NHS, rather than actually getting people to pay taxes, getting corporation tax, getting, you know, the rich to pay taxes, getting corporation tax to go up, and actually funding the NHS properly, the changes of the NHS towards digitalisation, I think, are quite important. That we need to monitor this and respond to this as community, because otherwise there are real dangers around this. So somehow, when we think about COVID, we also now have to think about the broader impact of this disease in society, and how the COVID can sometimes be used as an excuse to introduce measures that, you know, will harm communities more. So we need to be alert and you know, and fight back against those things.
And if I might offer a solution that ties to the previous comments about libraries, one of the things that comes up from the UK Digital Archive, which is an amazingly sensible bunch of people on UK data, they're just brilliant. They think about solutions, not problems, and setting up blocks and things, is that they're bringing up this concept of having a trusted location. And I'm wondering if there could be a pot of funding for local libraries to set up a trusted, secure, small, you know, a couple of rooms with computers in them, that the community that doesn't have access to good internet and things could go on in a secure manner and look at their digital health record and vote and whatever it is that could be interfered with. If people, you know, the commercial companies would like to have access to the data. I'm wondering if the libraries could almost save themselves by becoming a trusted digital hub. And I realized that, and a lot of librarians will actually have had training in all of the data security and all that kind of stuff, because the library training has been looking at the digital side for at least 2 decades, probably more like 3. So the expertise is out there.
Thanks, Shona. I think that's a really interesting provocation. We are going to go to Paul to ask his question. Paul, if you would like to unmute yourself.
Hi, yeah. Government long promised that they'll have an inquiry into the pandemic, how it's been handled. Terms of reference been out for that, but I'm just really interested to know whether people think there's any hope that they'll learn the sort of lessons that we've been talking about tonight about better communication with communities, hard to reach communities, better ways of increasing trust. Can we hope anything from this inquiry?
Thanks, Paul.
Can I comment? I'm the foreigner coming in on this again. I think that the inquiry will be as effective as the person who runs it. Think of the woman who did the work on the Rotherham child sexual exploitation thing, and the amount of uptake it gets by the media and the general public. So you can all do your part and spread the word so that it won't be buried. Just thinking about how long Boris sat on his current little problem, and he hasn't managed to avoid it. So to be honest, I think this is a classic example where all the communities that are worried about inequalities, which is probably all the community associations, could be involved in lobbying for a good person to be in charge of it, and then lobbying to get whatever the findings are actually turned into change, law, policy, whatever's relevant.
Can I come in, Johnny?
Yeah, please go for it.
Okay. I often think that these inquiries sometimes are a distraction to a lot of things that could have been done better. We've got so many things happening in this country. People are affected by different health issues, and there have been a big impact on people in terms of long COVID and not only long COVID, and how people have lost their life due to, carelessness or not the correct information of being shared, or people not taking responsibility when, for example, NHS staff may share about their concern. So for us to for the government, not us to use that money to do an inquiry, couldn't that money be used to do other things that are more relevant in this society, in the communities that are more affected by it, to be honest? And how would that inquiry help? I would like to see, how would that inquiry help people? What was the aim and objective of it? I'm not familiar that there was an inquiry. That shows how much I don't listen to the government. and all the news that is broadcast every night in terms of, you know, an inquiry being carried out into this pandemic. I think we need to think about communities and what more can we do to help communities, you know, via central government. I guess everything may come from, you know, 10 Downing Street or the scientists or whatever. But in my view, we've done inquiries and inquiries, and the poor still remain poor. You know, the good suffer because of the bad. And all of the money that has been spent in all this investigation and things like that, it's us taxpayers who are fitting these bills.
Can I respectfully disagree? I think that with the right leadership, such as we saw with the child sexual exploitation review, I think you do get change, and you get substantial change, and the public embarrassment of the behavior of the law enforcement people and the people in social care was highlighted and has made major change. My neighbor works in Rotherham, and she said the change in attitude is just absolutely amazing. And I teach in social work, not very much, I'll be honest about this, but I do meet the master's students, and they have all commented on what a major seminal effect that particular review had on behavior, attitudes, and a whole variety of other things in social care. Now, I think Paulina, I thought she might leap in and argue that wouldn't it be nice if we could actually document the sleaze that we thought was going on, the misuse of public funds, so that at least it's documented by somebody of the standard of Sue Gray or someone similar, because frankly, they wasted a hell of a lot of money.
So I don't know if that's for me to come in, but can I just say, I think, so I would agree that public inquiries have value. Obviously, it depends who leads them and what the terms of reference are, if they're broad or they're narrow, that sort of thing. So it's quite important to engage with issues like the term of reference, who's involved and things like that. But in generally, public inquiries represent a learning opportunity for society about, you know, how something was tackled. So as a learning opportunity, these are very, very important, you know, events. I obviously would put in terms of reference the whole, you know, all that happened with respect to the contact tracing, how it was done at a private level, national level, private level, when it could have been done more at community level. All the lessons that we've learned could be articulated in that public inquiry. The second issue is, well, will the government actually implement the policies of the inquiry? That's a separate issue. Do I have confidence that this government will do that? No, not at all. But hopefully future governments would do. So the idea is that the inquiry is more of a learning opportunity for society to discuss these things, for learning to take place. And well, obviously, if this government wants to implement anything, fantastic, but actually it's more about future governments and for us as a society to understand what should be done differently, so that we don't have the sort of, it's not just mistakes. Some of these things were just, you know, were conscious attempts to take advantage of a crisis for private benefit, and that can never happen again. And I think the more that these things are exposed, the better it is.
Thanks, Paulina. So yes, I think it's important not to lose hope completely, because there is precedent for things to change, but I don't think it's unreasonable for the expectation to be without wielding the incredible amounts of power we do have, if we can kind of get together and force them to do the things that they should do. It would be perhaps a little ambitious to expect them to do it of their own accord through some sort of moral standing. I can see you've got your hand back up, Paul. We just have a couple more questions that I'm going to try and fit in the end. So if you've got any feedback on that, if you could just drop it into the chat, because I'm aware we've only got about 3 or 4 minutes left. Our next question is from AJ, and it is, 2 seconds, I'm just scrolling. Was it right to pursue a one solution fits all vaccine drive, or were there other considerations around natural immunity, lower risks factors to age or other similar things below kind of 40, moving away from individual healthcare and using a blanket healthcare approach, which I'm sure is not necessarily in everybody's wheelhouse of expertise, but that is the question.
Because it was new, we didn't have enough information, and it would have been unethical and probably unsafe to make an immediate decision till we could get enough information. And it's surprising how many people have to be vaccinated or exposed before you have some confidence of your decision making. Okay, brand new disease, not enough like anything we've had exposure to before for us to make any assumptions. I know Jonathan came from flu, so he would have been pushing for an influenza type response immediately. He spent years chasing bird flu. He still owes me £5 because it turned out to be swine flu. But you know, it makes a big difference. You just can't make assumptions early on, and you err on the side of caution when you're working at the population level. This wasn't about the individual, this was about the population.
Brilliant. Thank you, Shona. Appreciate that. We've got kind of a minute or two left. So closing remarks from each of our wonderful panelists would be great. And I'm going to try and frame this in a positive way looking forwards, but feel free to add whatever thoughts you have. In terms of us looking forward and looking at the learning, regardless of whether that expectation is for the government to learn and do things differently, or whether it's in communities or for ourselves. And that can be in the context of the pandemic, because unfortunately it's unlikely that this is our only pandemic. It's something that will occur at some point in the future. It's just a question of when, or whether it's in terms of the legacy of the pandemic, in terms of the actual things that it caused, or the kind of the mental health and well-being things that we could make interventions of that would benefit people in a more general sense, not just in and around the virus. It would be great to get kind of sort of joint learning and thinking of the things we would like to change and learn from the most going forward from each of our panelists.
Well, just in the interest of time, for me, well, there's lots of things actually. One is it's the issue around health inequalities and you know, how to, so the pandemic has really brought up the problem of the challenge of health inequality, and I think that has to become far more embedded in the way the NHS at the moment approaches solutions to problems. And the other thing for me is the importance of community scientists, and so the work of academics and researchers and scientists to work with communities, not only so that scientific advice gets to communities, but so that we understand the challenges and issues faced by communities, so that we can address those, give more urgency to addressing those. That would be my final thought.
I think for me, it's really good to learn from each other, whether you have got the medical background or not. And it's an understanding of what is happening in community for us to be able to work together to make the necessary, what should I say, give the necessary information. But I feel that everything we do, there's a learning element, and there's also scope for you to be able to learn the information or learn about what is happening and to develop on that and to bring communities together. So my hope is that whatever we've learned and whatever community groups have developed during the pandemic, that legacy will carry on, because at the end of the day, nobody knows when this will end, because I don't think it's come to an end. But I hope that whatever the community the contact tracers, the group that have been formed and other organizations have done in communities, that this will carry on, so people will continue this legacy of learning and sharing and build up that confidence and trust with each other in communities.
Hear, hear.
I think I'm going to end somewhere near where Shona started. We have to acknowledge that we've had a lot of dismantling of things like public health, like community development frameworks, like you know, local basic systems and structures for the most vulnerable communities. Like, you know, there are no community development workers, there are no youth workers in the same way that there were before. There are very few libraries, very few post offices, you know, very few GPs that have the space and time to do the type of interactive work with communities that would get better results for the community as a whole. So I basically think a legacy has got to be that we have to campaign and fight and challenge the sort of like, you know, government's move to try to do business as usual, which is what is happening already. And we have to learn to be our own orators. We have to learn that what happened in the community conversations, people were confident to take roles, and we need to get back to doing more of that at a community kind of like action level. We have to have more community scientists, we need to grow people with different languages, with different cultures, with different faiths that are going to actually occupy different spaces in what makes up the society that we all live in. And we have the capacity, we have the ability, basically. We just need to make sure we keep holding on to these threads that connect us all together.
And for me, I think you know what was the biggest pleasure was working with other people, similarly minded people. I felt like I'd come home to a public health that no longer existed anymore. It was a treat and it was a pleasure, and they let me have my rant. We all had a rant on a regular basis, to be perfectly honest. I mean, it was an absolute pleasure. The joy of working in public health is the community side for me, even though I always get stuck on the data side. I love the community part. I think that's where the most change happens. I think that's where the most learning occurs on both sides. And I always start off my conversations by saying, I'd love to hear your opinion, but don't insist I agree with you, right? I'd like to have a debate. I'd like to have a conversation. I can still remember saying to one friend, why don't you go out anymore? Right? She grew up working class like me, but in Germany. And she got all defensive. And I said, I don't want you to be defensive. I want to tell me how you're thinking right now that you've decided that you aren't going to go out and meet with people anymore when you did so before COVID. And so we had this nice long conversation where she'd suddenly realized the world was infectious, which it always had been, but she hadn't known. Right? She's still not going out very much, but it's better than it was, and she isn't suffering so much from the mental health issues. So it's a conversation, and I think we've forgotten that. And with the dismantling of public health and it being reduced to an occasional person in a local authority, they haven't had the capacity to listen. They haven't had the data to make decisions, and they don't have the connections back to the public that they would have had through the public health workers in the past.
I think that's a wonderful point to end on, and it's been mentioned throughout this evening is the importance to keep talking to each other, and even if those conversations don't go right the first time, to keep trying to have those conversations and build those relationships and that trust. And I think one of the biggest things about the Festival of Debate is that the debate doesn't necessarily happen at the event. It happens in the conversations that come after the event, having had, as we have done this evening, the wonderful insights and provocations that get our brains thinking. And once we've had the chance to reflect on them, we're resourced to have more conversations and hopefully better informed conversations. There is, as I mentioned at the start, a couple of opportunities still left to engage with the Festival of Debate, which is on until the 30th of May. And we have an event also on the 23rd of June. Susie, did I see your hand go up there?
I just want us to, one of the things I realized I hadn't said it myself, we need to remember, as well as having the conversations, we had community action. What happened with the community conversations is actions, and that is where we need to be, where there are actions, basically. You know, so yes, conversations are good, but we need to actually sort of like make into different spaces of actually what are we going to work towards in terms of creating change.
I mean, anybody can complain, so now find some solutions. This is one of my big statements, right?
Brilliant. Thanks for that, Susie. And it is, yeah, really important and in how we kind of move forward to taking those actions and hopefully growing those actions to actually get as far upstream as possible. So we're looking at the systemic issues rather than just the symptoms of those issues as well. It's one of the things that underpins everything that Opus does and the festival is how do we get upstream so that we're not just constantly firefighting. Obviously, we can't all stop firefighting because there are lots of people in need, but we need to also start having those conversations, taking those actions to get to that point where we can, like you say, actually start to make some change. I realize we have run over ever so slightly, so thank you all for sticking with us. An absolutely huge thank you to our panelists this evening in Susie, Yvonne, Paulina and Shona, and we hopefully will see you again soon at another Festival of Debate event. Thank you so much for joining us, and we'll say good night.
Thank you and good night.
Thank you, everybody.
Thanks, everybody.